Ladies and gentlemen, thank you, Dr. Varsha, Dr. Aditya, for such a kind talk, I must say. And I could really see the sugar rush in your presentation post the break. All right, so these are a few of my credentials. And I first start off with paying my homage to the late Dr. Temtan Udwadia. So he's a professor emeritus. I had the opportunity to work for some time under him when he was attached to the IMAST, and he has got the first laparoscopic cholecystectomy, which was done in 1990. That was the first in India at Sir J.J. Group of Hospitals, which I'm a proud alumni of. So firstly, disclaimer. So the next 20 minutes is brought to you with a generous dose of humor and a pinch of sarcasm, more so intended to both of my competitors, I could say, or the debate speakers. So whether you're a salad enthusiastic or an endoscopic advocate or maybe a surgery supporter, I would still say, please remember, we are the same side, we're on the same page, and that is the team health. And so no offense intended, so I'll start right away. And more importantly, you can be soothed with a complimentary wheatgrass juice at the banquet. So first, I would just come to this slide. This was back, I think, when I was a kid at 10 o'clock in the morning, Sunday morning specifically, we used to have this Mahabharat where I feel that was extremely popular show. And there's a character, Ghatotkach. And at that time, it always seemed like Ghatotkach who's obese, and there's nothing wrong with it. So he was just a bit more healthy, that which could said that. Fast forward, we came here now, so a few years back to the newer Mahabharat. We started seeing a lot of fit Mahabharat characters. This was the Ghatotkach, so there is a significant change. I'm pretty sure nutrition, or maybe probably would have taken help of some surgical intervention, or maybe, as my friend just showed, some endoscopy procedures. Same thing goes for the South Indian movies, the movies from the southern India. I still remember back in 90s and 2000, we used to have these typical channels, sun channels, where the lead actors were surely flaunting their pot bellies, and there was nothing wrong with it. But come back now to the one which we all know of, Bahubali. It's something which is a great work, and that's very much clear from the way how the main hero is looking now. So firstly, bariatric, as we know, it's surely a weighty issue. As we know, it's a obesity endemic, which is there present, epidemic which is present in India and all over globally. Due to certain cultural habits, the awareness needs to be there, and many factors which can keep on going on and on and on. Okay, I'm not going to get into much of the incidents or the details. So firstly, we just look at the evolution of these bariatric techniques. So back in 1950s, the first early attempts which was done was to somewhere introduce a bit of malabsorptive procedures, jejunal bypass, and bypassing most of the small bowel. But somewhere it didn't work as much as what it was intended for. Next, in 1960s, the Ruawai gastric bypass started coming in with it. They had some promising results also. Then up in 1970, we had the vertical banded gastroplasty. And back in 1990s, then the laparoscopic revolution came, and that changed things drastically. 2010s was the era of my friend, dear friend, Dr. Aditya. So endoscopy procedures started picking up. And surely it has now reached a very good level, I would say, that people are doing those procedures, are increasing numbers. And more of a collaborative approach slowly and started coming in, where nutrition also plays a significant part, and endoscopy also in certain bridging techniques. And the focus now is more towards an enhanced safety profile of the patient. So let's begin this SmackDown match and the ultimate weight loss showdown. Who will win in this? So firstly, let's meet the contestants. So we have nutrition, which is the natural choice. Second, we have Dr. Endoscopy, who's a minimal invasive marvel. And thirdly is the surgery, the heavyweight champion. So Dr. Nutrition, the natural choice. Now this is the classic approach. However, can the traditional nutritional compete in the weight loss arena? That's what the big question is. First important thing which we see is the lifelong commitment, which is something I feel a problem which is difficult for even Dr. Varsha to deal with all throughout. Secondly is the metabolic adaptation, are there limitations which are present. Thirdly is the average weight loss. I mean, there's a lot of effort which goes in to get that weight loss. And fourthly, the biggest factor is the behavioral change with the patient needs, which is lacking in most of the time, most of the places. So a nice thali like this, which is highly nutritious and tasty, looks good, but majority of the patient has to face a similar situation, eating a bowl of salad at least to start off with till they get into the maintenance phase. So a friendly debate to talk about nutrition versus surgery. Nutrition provides slow and gradual weight loss results, but within months or possibly years as well. It may not lead to a long-term remission of diabetes, which is one of the added factor of the surgery and one of the most. Requires lifetime adherence to food habits and control, which is one of the most difficult tasks for each and everyone rather, not just the obese, for us as well. And is suitable for all, but need not be effective in most of the patients. So that's the shortcomings of the nutrition part. It cannot result in significant health improvements quickly as we intend to, and not a solution for severe obesity where it can create with the related ailments, and may not address the underlying emotional eating habits. So as I love this slide which was there, one takes a lifetime control and other takes 90 minutes of anesthesia here to have a good amount of weight loss. So next up, again, we have Dr. Endoscopist, who with his minimal invasive Marvel, which has picked up in the past 10 to 12 years back. So as Dr. Aditya had just mentioned, a wonderful device, which is a balloon which has come, which takes the, occupies this part of the stomach and the natural satiety feeling which we end up getting. So surely it has a good recovery and it has been rising in popularity here. But the long-term results are extremely questionable. So it would help, no doubt, but still that is going to be for a brief period of time. Once everything goes away, the patient is going to come back to his usual regular habits. So can it compete? So let's see. Patient satisfaction here can vary with the different expectations. Again, limited long-term efficacy results here may not be sustainable once the effects and the balloon, which is being on, as Dr. Aditya had mentioned, after 4 to 6 months. It may serve as a bridge for patients considering surgery. So that's one of the most important, I would say, the aspect of this balloon. So surely super obese patients whom we can't right away operate because of certain comorbidity, those can be very well introduce the balloons and a bridging therapy followed later by a surgical definitive procedure. Higher patient satisfaction due to dramatic weight loss, again here is questionable, and more effective for so severe obesity cases, as I just mentioned. And it requires, again, adherence to lifestyle changes for effectiveness, just like the nutrition counterpart. And it is not, again, suitable for all the obesity types. And the last, what we have, the bariatric surgery, who's a heavyweight champion. So there are different procedures, I would say, an array of procedures what we have, right from the gastric bypass, the Roux-en-Y gastric bypass, the one anastomosis gastric bypass, the vertical banded gastroplasty, the sleeve gastrectomy, the duodenal switch, and it can go on and on. Significant weight loss is what we achieve, and it's very much important in these individuals because we want a sustainable results. So the options to have a substantial and a sustained weight loss. Thirdly, common misconceptions that many believe surgery is the easy way out. Absolutely, ask someone who has undergone a knife, or any one of you who has undergone a knife. So surgery is surely not that easy to go through. Long-term benefits, as we all know, it's a sort of permanent method, what we can say that, which helps to reduce the weight and get into shape. And surgical commitment, which is very important here. So necessitates the commitment to follow-up care and the supportive care here. So this is a comparative, I would say, a graph here published in the ASMBS. So it was based on the systematic review of scientific data from 2020 to 24, showing the different modalities for the weight loss. And this surely brings happiness or smile on certain individuals who have been fighting and struggling a lot in the youth, facing a lot of depression, and certain people who have been working in the workplace, the job efficacy is reduced because of that. certain personal lives have changed. So all these patients who have undergone this surgery have had a very good results as well as a happier life, which they do evolve into. So the case for bariatric surgery, a significant weight loss, I'm just going to emphasize the health benefits, the sustained results, evidence-based success, proven treatment method. Okay, let's see about the myths and the facts, what we say about the bariatric procedures. Firstly, it said bariatric surgery is extremely dangerous. Is it? Or is it not? Absolutely not. With the advent of the newer anesthesia techniques and the popular newer drugs which have come, it has become one of the most safest procedure, I could say, if due precautions are taken. Fact, it is not cheating. It's just a smart way out to evolve yourself into a better human being, into a better person, into a fit person. It's only for the weak, as I just said, not at all. It needs to have really a brave, blind heart, I would say, to undergo a knife. Long-term benefits, as we all are aware, are countless. Okay. Surgery is irreversible. Absolutely not. In certain cases, certain surgeries can't be, but many of the surgeries we can reverse it in certain individuals which have the specific indications. Supportive care, which is essential with the surgeon. Now, life beyond weight loss. This is just not about eating good, and it is not just about looking good in shape, but it's beyond that as well. So what are the aspects of this? Diabetes remission. That's the first most important thing which has been seen, and there are good studies and data to prove that. Improved cardiac health. Thirdly is the enhanced daily activity because of more agility and the fitness with the patient gains. A long-term weight loss maintenance is very much important, which is very difficult with the help of only nutrition or only endoscopic methods, and a mental well-being which comes along with it. So patients here typically lose a good significant amount of weight. Also, there's a long-term improvement in the quality of life, and the average weight loss is also very good. I was just discussing with Dr. Varsha, I do need to give a weightage and a mention that nutrition absolutely can't be ignored. That's one of the most important factor here, because nutrition is the key. So even after a bariatric surgery, and that holds true even for an endoscopy, a good nutrition is surgical counseling and post-surgical counseling are very, very important, with the help of the balanced meal, certain culturally relevant foods which can be used, and the foundation of health, and here a long-term commitment is seen. Okay, same thing goes, due consideration to my dear friend, endoscopist. It's a minimal invasive marvel which you have seen. It's surely a good alternative to surgery in certain individuals who can't undergo surgery right away. There's a quicker recovery because there's I would say a lot of times our OPD procedures, and effective for selective cases, and a promising health improvements. Need I convince more? Or need I talk more? I think the results are very, very self-explanatory. So surely the bariatric surgery here clinches it, and it's the heavyweight champion, I would say. Okay. However, it's ultimately a collaborative effort of the nutrition, which is the strengths of the nutrition and the endoscopy procedure, where a lot of times we work in tandem, we work together to bridge this gap with the help of bariatric surgery for a patient well-being. Okay, so the final verdict, bariatric surgery here triumphs. Nutrition is a very, very vital role, and endoscopy, though minimally invasive option is present, it can be helpful in certain individuals, and a personalized patient has to be catered accordingly. The treatment profile has to be decided with a good long-term success rate, and all options here have a value. Thank you very much. Happy to take any questions.
Thank you, Saurabh sir.